Hello, and welcome to Karen's Medical Corner. I'm Karen O'Day. I'm a certified family nurse practitioner and a certified nurse midwife with a practice in Santa Fe, New Mexico. My practice involves providing family health care as well as women's health care, aesthetics, and bioidentical hormone replacement therapy. I'm starting a series today on women's health. The first topic I would like to discuss is urinary frequency, urgency, and urinary incontinence. So many women, millions in fact, suffer from these symptoms. Many times they're not discussed with friends or family and often only talked about in a provider's office if they are having significant symptoms. Sometimes by the time women actually come into the office, their symptoms are so severe that referral to urogynecology or urologist that specializes in urology and gynecology is necessary to effectively treat these women. If this were addressed earlier on, sometimes there are treatment modalities that can be done that can actually be very beneficial in helping relieve symptoms and also in helping prevent surgery. So we're going to discuss those issues today. So urinary frequency is any type of desire to urinate multiple times during the day and or at night, and usually involves the process of going to the bathroom multiple times but having a small volume come out each time. It's not necessarily urinary frequency if somebody is drinking a gallon of water a day, having to urinate frequently, but having a large quantity come out every time they urinate. That would be considered fairly normal if you're consuming large volumes of fluid. Urinary urgency is an urge to urinate. Oftentimes it is accompanied by, again, little volume of urine coming out. So women are going to the bathroom frequently. They're not having much volume come out. And they feel like when they need to go, they have to go right now. That would be symptoms of urinary frequency and urinary urgency. Now, urinary incontinence is basically leakage of urine, and it can occur with urgency. Sometimes women feel like they have to go and they have to go right now, and if they don't get to a bathroom, they'll have some leakage of urine from the bladder into either a pad or underwear. And stress incontinence is when women will be running or exercising, laugh, cough, or sneeze, jump on a trampoline, and they have some leakage of urine. That's basically lay term definitions for what we're going to be discussing. So there are many treatment modalities that women can try, and oftentimes people will see numerous medications on the television. You know, if you're having urinary urgency or urinary frequency accompanied by incontinence, you can try a barrage of medications. And a lot of times those medications work very well. However, they're all accompanied by side effects. Many times patients want to have treatment options where they're not taking a medication every day that's going to interfere with other medications or foods that they eat or give them side effects that are undesirable. Some of these treatments that do not include medication include physical therapy for pelvic floor strengthening. That used to be the mainstay of therapy when people would come in. We would send them to have physical therapy to help strengthen the muscles of the pelvic floor. And that helps strengthen the bladder, the urethra, and also the vaginal walls. However, there are approximately 14 pelvic floor muscles, and many of those women can't voluntarily control very well. It's hard for them to feel where those muscles are and how to tense them up. Other treatment modalities include surgical intervention. So that can include a bladder suspension, sometimes mesh is used. It is a surgical procedure. It does work fairly well if the woman is a good candidate for the surgery, but it does involve surgery, and obviously there are risks to all surgical interventions. There are some newer treatment modalities that are available, and one that I really like and want to discuss today is put out by InMode. That's INMODE, and it is part of their women's health platform addressed to specifically treat these issues. So InMode has a platform for women's health, and depending on the severity of symptoms depends on the treatment modality. So somebody who comes into the office having urinary frequency, urinary urgency, and maybe a little bit of incontinence may be a good candidate for what's called a Vtone treatment, and that's Vtone. And what that involves is electronic muscle stimulation. Now, this stimulation occurs by inserting a small probe into the vagina that has plates on each side that deliver an electric stimulation that actually encompasses a 360-degree range inside the vagina, treating all 14 of those pelvic floor muscles. And it is the woman controls how fast and how intense the pulse is delivered, and so it's something that's not painful. Women sometimes, when they first come in for a treatment here, will be a little bit nervous because they're afraid that it's going to hurt. And then as soon as I pull the machine up to them and I tell them, hey, here's the machine, you get to control how intense the pulses are, then the next treatment, they're fantastic. Their fears are alleviated, but it is a very simple treatment. I'm going to step away and just get one of the probes so that I can show you what it looks like. So this is the Vtone device. As you can see, it's got a little plate on this side. If you turn it a little bit, you can see that there's a plate on the other side. It's inserted into the vagina so that the plates are on the side walls of the vagina, not up or down, but actually going in so that they're hitting the side walls of the vagina. It has a little cord, and it's plugged into the machine. The machine can deliver pulses in an intensity of 0 to 50 in strength, and so again, the woman gets to control how strong those impulses are. The treatment is 30 minutes. We usually do a treatment anywhere from every 2 weeks, sometimes every 4 weeks, depending on the severity of symptoms. And it is FDA indicated for urge incontinence, stress incontinence, mixed incontinence, which includes both. And so in treating the incontinence, obviously by strengthening the bladder wall as well as the sphincter through this muscle stimulation, it also it also helps with urinary frequency and urinary urgency, which are part of the symptoms for the incontinence. So in their clearance, they have clearance for FDA clearance for incontinence, not for frequency and urgency, although it works very well in treating those because those are all incorporated into the common problems that women are having as far as urological issues. Because it's placed into the vagina and it's stimulating through muscle contraction all 14 of the pelvic floor muscles, it is also helping to tone and tighten the vaginal walls, as well as we see improvement in the rectal walls for women who have uncontrolled expulsion of gas. Now again, it's not FDA cleared for that, but we've been seeing improvement in symptoms, significant improvement in symptoms with that as well. The treatments cost anywhere from $250 to $275, depending on if a person pays as they go or if they pay for a package. Most packages are sold in 6 package treatments. Now, if somebody's incontinence is a little bit worse, where they're having leakage with just a little amount of stress, or their urge incontinence, as soon as they need to go, they're having a little bit of leakage, we can use what's called the FormaV. Now, the FormaV is a radio frequency device, and you can see the plates on here. This is a bipolar radio frequency, so the patient does not have to be grounded as far as having a pad placed on their back, because the you'll have the radio frequency impulse come out and go into the tissue and then go right back into the device. So this is a really nice device. We use this inside the vagina. The provider uses it. It's has ultrasound gel put on it. The probe is inserted so that it's going in not this way, but this way, so that it's going in vertically. And it's turned in a 360-degree fashion so that it's hitting the entire vaginal wall. And it's moved out slowly and then moved in slowly over a 30-minute period of time. And this works really well for a little bit more severe urinary incontinence. And then we use that in conjunction with the Vtone. So we're getting muscle stimulation as well as with the FormaV. The radio frequency is increasing blood supply to the area. It's increasing nerve supply to the area. So it helps overall with not only urinary incontinence, but again, frequency and urgency. And that's what it is cleared for through the FDA. But we're also seeing a huge improvement in sensation as far as vaginal sensation and perineal sensation. So this device can not only be used inside the vagina, but for women who have a decrease in sensation for the clitoral area, it can be used for that as well to enhance feeling and sensation. It's also, as it's radio frequency, it's also used on the labia minora and labia majora to help tighten that area in response to people who have had, say, a vaginal delivery and trauma to the perineal area, or sometimes when women are athletes and they will have injury down there, the labia can sometimes become painful in response to bicycle riding or other activities, and so this helps to tighten the perineum, the labia minora and the labia majora, and so women are using that for that as well. They also use it for aesthetic purposes too, if they are feeling a little bit uncomfortable as far as the appearance of the perineal area. So that one is for kind of a moderate urinary incontinence. Now, the one that we use for more severe urinary incontinence, women who are just having a little bit of kind of chronic leakage, they have a lot of urgency, a lot of frequency. This is the Morpheus 8V, and this is a radio frequency microneedling device, and that device is used, again, the microneedles are right here. The woman comes in, she's numbed up with numbing cream that goes into the vagina and on the perineum for about an hour to an hour and a half, and then the probe has gel put on it, and the practitioner again does the treatment. With the numbing, it is not a painful procedure. Very occasionally I'll have somebody tell me that they feel a little bit of pinprick, and usually that would be if they were not numbed up for long enough. So I like to have women numb in the office for about an hour and a half. You can again use it on the inside of the vagina, and it's FDA indicated again for bladder leakage, so urinary incontinence being either mixed or standalone urge incontinence or stress incontinence. It works very well for urinary frequency as well, although not FDA indicated. It also works very well for toning of the vaginal wall and increasing nerve stimulation to enhance women who have a decrease in sensation. This can also be used on the perineum to also help tone the perineal area, the labia minora and the labia majora, and it is a very effective device in those areas. But again, it is FDA cleared for urinary urgency and urinary incontinence. So for the Vtone, which is the muscle stimulator, that's usually a series of 6 treatments. The other 2 devices are usually a series of 1 treatment that is done a month apart. The FormaV, which is the one we talked about second, does not require any numbing. It is not painful at all. It delivers radio frequency heat to the area, and women, you have never had anybody complain of discomfort. So I wanted to introduce these. We do have Morpheus in our office. It's very effective. I've been really impressed with it. Every patient that I have had so far that has done this treatment has noticed a significant improvement, and that would be including myself. I think that it's an excellent alternative form in helping people avoid surgical intervention and in taking medications. Now, InMode, again, is the company that sells the platform that has this device, and it is used widely across the United States. So if you want to find a provider in your area, you can look up InMode providers and you type in your state or your zip code and it'll come up with a provider in your area. In Santa Fe, we are doing it, like I said, at the clinic. We offer package deals for that as well as people who want to pay as they go. But it has been a game changer for my patients, so I wanted to introduce it here. We're going to talk more about other women's health issues, but I've just been seeing recently in the clinic multiple women coming in with complaints of urge incontinence, stress incontinence, urinary frequency, and these treatment modalities are effective for a number of women. Of course, when you see a provider, you should be cleared to make sure that this is a safe treatment for you. So there are certain conditions in which we can't use radio frequency, like if somebody has a pacemaker, certain conditions where we would not use radio frequency if there are certain vaginal conditions such as vaginal infections. So a vaginal exam is done prior to having any treatment, making sure that it's appropriate for the patient. But again, these treatments take about 30 minutes. You can have treatments in combination. So the electronic muscle stimulator, which is this device, I use for every patient. I don't always use the FormaV or the Morpheus 8. It depends on the symptoms. But when I do use the FormaV or the Morpheus 8, I always incorporate the electronic muscle stimulator because it is just an amazing device that really helps with strengthening all those pelvic floor muscles as well as the bladder. So if you have any questions, any concerns, any comments, please don't hesitate to reach out. You can reach us on our website at www.evercarefamilypractice.com. Our email, which is evercarefamilypractice@gmail.com. You can reach us on Twitter, Facebook, Instagram. You can reach us on the podcast, on Patreon, and on Pinterest. So if you have any questions, let us know. I look forward to any comments. I love comments, and I want to put a shout out to our listeners, Kathy V, Amanda, Melinda, Wes, as well as our California listeners, and all of you who have taken time out of your day to spend some time listening to the podcast. So thank you so much, and I wish you happiness and a long and healthy life in choosing to do what you decide is best for you and making sure that you're getting the health care that you need. Thanks so much. So pricing for the different treatment options, again, the Vtone is typically between $250 and $275 a treatment. Treatment for the Vtone ranges between $1,000 to $1,200 a treatment for 3 treatments. The Vtone is usually going to be a 6 treatment, and then the Morpheus 8V ranges anywhere from about $1,200 to $1,500 a treatment, again for 3 treatments, and pricing varies based on any specials that somebody may be offering, or if you pay individually as you go or through a package. Thank you again for joining us. Okay.